Hello everyone, this is Dr. Kanaan and today we will talk about night guards. Before we start talking about night guard, why you need a night guard, what are the types of the night guard, I want to share with you something where I'm sure you have been to one of these ancient cities like Rome. You will notice something with these old cities that they have worn steps. And we always know that these worn steps comes from excessive usage. The same concept that happened to these worn steps will happen to your dentition with excessive usage. You don't want to have worn down teeth toward the end of your life like this. And that's where the night guards come in to protect your teeth, dentition, and muscles. So, what is a night guard? A night guard is an appliance that you wear when you sleep, and it's usually made for the upper jaw. By wearing that night guard at night, it will protect your teeth. Now, why at night? Because most of the clenching will happen when you sleep. The other problem with grinding, when you use your muscles will get bigger and tighter, and that can cause headache, it can cause trigger points, it can cause, in some extreme cases, tinnitus in your ears. So here where the night guard will come to protect you from these potential harmful symptoms. What are the type of night guards? There are three types of night guards. The first one, usually patients they go to the pharmacy and then they buy one over the counter, and they come something like this, and they're generic, they're non-custom made, and the patient usually they have either to trim it or boil it in some hot water so they can form it to their mouth, but then they carry no anatomy or no function. And I don't ever recommend these ones because they don't provide the proper function to balance your teeth. Now, if you want to use it, if you are like a teenager or early 20s, you have no symptoms, just for an extra protection, that's fine. But if you want to use these ones for long term, they always cause, or they mostly cause, harm more than benefit. I want to share with you a case of one dentist. This is her bite before. You see here she has good occlusion. Once she got the over the counter night guard, watch how much opening she has got. Because these night guards are non-balanced, sometimes they don't cover the whole dentition. Again, no, I would never recommend this type of night guards. The second type of night guard is the one that is like a retainer. It's made from a thin sheet of plastic and it carries no function into it. And you might consider this one like an entry level night guard. They usually cost $200, $250. Would I recommend them? I would recommend them only as a preventive measure if you have no active symptoms. So if you have no headache, if your teeth are not worn down, then I would recommend them. But if you get this one and you're a heavy grinder, you're gonna chew into these in like 6 months, maybe, if not sooner. Now, here is the one that I like. This is a functional night guard. It's made of thick acrylic. It's a hard acrylic from outside, so it will resist the wear and tear from grinding and clenching. And we line the inside with soft material so it will give you some comfort when you wear them. It's not supposed to cover all your front teeth. It will cover maybe one third to one half of the teeth to make this the night guard more comfortable. If you don't feel it comfortable, you will not wear it. So the night guard has to be comfortable in order for you to wear it. Now, how we make night guards? In the old days, if you want to make a good night guard, I used to use a semi-functional articulator where we take a mold for the patient, jaw upper and lower, and then we put all this measurement and we fabricate a night guard based on that. Now we are blessed with the 3D. You can scan a patient. I will share with you a patient right here where we did a scan for a night guard, and then you can physically check the contacts, where the heavy contacts are, and you can send this one to the lab and fabricate a night guard based on that one. Now, once we receive this night guard, I never give the night guard to my patient and I will let him go. It doesn't work. This night guard has to be adjusted and equilibrated based on the bite that the patient has right now. So I put the patient in the chair. I want to share with you a real night guard that we have. So this is a night guard, and then you can see the difference between an adjusted one or an equilibrated one and a non-equilibrated one. And I take the record, we use articulated paper, and then I adjust it slowly until all the dentition is in balance when the patient is biting down and when he is in function. Because you don't want your night guard to be unbalanced where one tooth or few teeth are taking the force where the other ones are not taking the force. We want the excessive force when you grind to be distributed evenly all over the dentition. So after adjusting the night guard, I will give it to you. I will do maybe, as I said earlier, like maybe 6 to 10 sessions of adjustments. And then I will give it to you, and then you go home. I want you to wear it every single night. I will see you back in 2 to 4 weeks. And it's very important that I will see you back. Why? Because as you wear the night guards, these muscles that used to be tense, they will start to relax. As your muscle relax, your bite might change and the night guard will get out of balance. So you need to come back and then I will make a minor adjustment so the night guard is in balance again. Then I will send you home and I will see you back again in maybe 3 to 6 months. And we'll do the same thing. After 6 months, the muscles will be 100% in balance, and then I need to see you on a yearly basis. These night guards, I have a patient, she had them for 10 years, but usually you need to replace them every 6 years. But they can last up to 10 years. Now, how much this night guard cost? So usually we charge between $700 and $1,500 based on how many adjustments you need and the thickness and whether it needs to be programmed, fully programmed or not. If you have insurance, insurance might help with the cost. Maybe they will pay less than 500. So insurance might cover some of the cost, and then your out of pocket would be between $500 and $1,000 for the functional night guard. So how to clean the night guard? When you wake up, brush your teeth and brush the inside of the night guard with just plain water, room temperature water with a regular toothbrush. Now, one of the most frequent question people ask me, doctor, my night guard stinks or it smells bad. And that comes from the bacteria growing into the night guard. And this happens mostly when you clean the night guard and you put it in one of the containers. I want to share with you one of the bad containers that I don't like. Like these containers, they have no holes, they're non-breathable. If you put it here, bacteria will grow. Get one of the breathable containers, they have slots, and then after you clean it, you leave it open. Don't close it, let it dry, and then in an hour, once you feel it dry, you can close it. Nothing will happen when you keep it open. It's just gonna dry and then it will smell, it will keep fresh, smell fresh, no bacteria. But if you close it, then bacteria will grow into it and then it will smell bad. There's one important thing about night guard. If you are planning to get a night guard, the functional one, make sure that all your dental work are done. Because if you get a filling or a crown, then this night guard won't fit. I might be able to adjust it a little bit, but because they're very highly balanced, you have a very limited room for the night guard to be adjusted. And usually, if there's a major dental work, you have to get a new one. So I always tell patients, make sure that there's no cavities, no crowns, your cosmetic is done, then you get a night guard. Now we'll talk about the indications of night guard. When do you need to get a night guard? Or when you have to get a night guard? So if you are a heavy clencher, if you wake up in the morning and you have sore muscles, tight muscles, you feel headache, 100% indication. If your dentist have been telling you you need a night guard because you grind your teeth and you keep telling, oh no doctor, I don't grind my teeth, I never felt it. I'm telling you, you will never feel that you're grinding. I grind my teeth, I don't feel it. I but see it on my teeth and my wife tells me. And that's the same thing with you. Now, if you have veneers, if you have done any expensive work, let's say you get like 10 veneers, I would highly recommend you to get a night guard because if you grind these veneers, you will break them. If you have crowns on the top and you don't have crowns on the bottom, the ceramic, they have higher strength than your natural teeth, and you will end up wearing your teeth down. If you grind your teeth and you don't listen to me, I promise you, you will end up with this patient. So watch this patient. This patient, he never got a night guard. Then if you look into his dentition, you can see how much damage his teeth are. And this is a full mouth reconstruction. Most of his teeth are damaged, which needs to be replaced by extractions and implants. Very, very costly, costed over $40,000 per arch to get them replaced and corrected, which he could have avoided if he got a night guard 20 or 25 years ago. Now, if you have any questions or you think you need a night guard, give us a call. I can see you. We always do free consultation. We can scan you. We can check your bite, and then I will recommend you the proper and correct night guard that fits your case the best. Thank you for watching this video. I hope I gave you some good and valuable information and I have answered some questions for you. Again, if you have any questions, just call us or send us an email and we'll try to reply to you as soon as possible. Thank you so much.